The Cincinnati Health Department is scrambling to find a way to raise $650,000 to keep school nurses in public schools. City Council decided to cut school nurses from the budget at the end of the year. Janelle Walton was at Douglas Elementary today, where one school nurse says she's helping to save lives. Janelle?
Carol, the school nurse says a lot of people think they are at school just to check for a fever or maybe give a child a Band-Aid. However, she says in many cases they're helping to administer life-saving medication, and many worry what will happen if they're not around to do that.
School nurse Rita Porter checks this student's blood before giving him his insulin at her office at Douglas Elementary in Walnut Hills. She does it several times a day.
People think school nurses, all we do is give a pill or put on a Band-Aid, but it's so much more.
The Cincinnati Health Department says nurses like Porter also help keep track of public health issues like communicable diseases that could spread easily from one student to the next.
Remembering that having public health enforced at a school setting really means that disease outbreaks can be stopped right at the beginning, and a good example of that was with the norovirus outbreak at Mount Airy School last year.
The health department is planning to launch a campaign to hopefully raise the $650,000 City Council cut from its budget for school nurses.
What we have been doing with this program for years is looking at delivering public health for kids using the school as the setting, because that's where the kids are. So it really makes good sense to see that public health assurance happens in the school setting.
Cincinnati Public Schools has pledged to keep nurses on staff through the school year, even though Council's latest proposal would eliminate its portion of the funding in December. With 13 of the 45 nurses cut from the budget this school year, Nurse Porter says she hopes more aren't eliminated. Porter says she and her fellow nurses are making a difference.
Instead of just giving the immunization to get the numbers up, we actually hook them back up with a medical home. That way they're not utilizing the emergency rooms for things for child checks or just sick visits that can be taken care of.
It's possible funding for the school nurse program could be put back in the budget because Council hasn't voted on a final budget. In the meantime, the Cincinnati Health Department doesn't want to take any chances. It's looking at ways to raise the $650,000 through private donations. Clyde?
All right, Janelle, thanks.